the underserved community of Huntington Station.
In part one of Group Five's community project, we identified and chose Huntington Station as a relatively disproportional and marginalized community for our community project. A comprehensive windshield survey was carried out and key informants within the community were interviewed. These included a school nurse who has served the community for 17 years and a local EMT with 10 years of community service. They provided a first-hand account of the community. Objective data obtained includes the population, demographics, education, transportation, recreation, safety, economy, available healthcare, and accessibility to these healthcare services. Huntington Station's community's strengths and health-related concerns were highlighted in the analysis of both subjective and objective data obtained. We identified strengths of the community, including diversity, business opportunities, and geographical location. From the windshield survey and information obtained from the informants, substance abuse was the health-related concern identified among the residents of Huntington Station. In this presentation, we will further enumerate substance abuse, available resources, its implication on individuals, families, and community as a whole. We will do a literary review of a peer-reviewed journal related to substance abuse and adapt its interventions to the Huntington Station community. Finally, we will leverage on these interventions to plan, implement, and evaluate education for the community. To reinforce this teaching, we will design a poster to appeal to our target population for effective education, focusing on at least three specific, measurable, achievable, relative, and time bound learning objectives.
The health related concern that we have chosen to address is the prevalence of alcohol and drug abuse in the community of Huntington Station. Only 10.1% of individuals report not drinking at all, while 64% report using marijuana and 25% report cocaine and/or heroin use. Alcohol is the most popular drug consumed by this community today. Alcohol use disorder includes alcohol abuse and alcohol dependence. Alcohol abuse occurs when drinking interferes with day-to-day activities, and alcohol dependence, or alcoholism, is when an individual has lost control of their drinking. Symptoms of alcohol use disorder include a strong urge to drink, lack of control over how much you drink, continuing to drink even though it's causing problems, and drinking that interferes with the things you normally enjoy. For men, drinking more than 4 drinks a day or 14 a week is considered alcohol abuse, while the same is true if a woman drinks more than 3 drinks a day and 7 a week. Drinking too much and too often increases the risk of accident and injury and also causes liver and other health problems and can lead to a more serious disorder. Men develop alcohol dependency at a greater rate than women. The population of Huntington Station has a greater number of males, which increases this population's risk of abusing alcohol. One theory holds that men have a naturally greater tendency to take risks, which leads to experimentation with drugs and alcohol as youths. Another possibility is that men's higher tolerance of alcohol leads to more consumption. There is also evidence that shows that alcohol consumption is greater among Latino men, as the quality of machoism is often associated with heavy alcohol consumption. The odds that a person from this population will seek help for a drinking problem are relatively low, which confounds the problem. Alcohol abuse is a progressive disorder that, when left unaddressed, can lead to alcohol dependence. Close to 88,000 people in the United States die from alcohol-related causes each year. Only smoking, poor diet, and lack of physical activity kill more. About 31% of all driving-related deaths are linked to alcohol. When alcohol abuse turns into dependence and alcohol is not readily available, an individual will begin feeling physical symptoms such as nausea, vomiting, headache, and anxiety. Alcohol withdrawal is a serious problem and can even lead to seizures and death. There are also mental symptoms associated with alcohol abuse and dependence, such as guilt, resentment, and a change in moral compass. Alcohol abuse and dependence can destroy a marriage or drive a wedge between family members. People who abuse substances and alcohol can blow through the family budget, cause fights, ignore their children, and impair the health and happiness of the people they love. Roughly 60 to 70% of married couples who get into physical altercations abuse alcohol. Children can be significantly affected by alcohol abuse. 1 in every 5 Americans lived with a relative who abused alcohol during their adolescence. These individuals have a greater risk of developing emotional problems compared to those who grew up in sober homes. Early exposure to an alcohol abuser can also increase the risk of a child developing a problematic relationship with alcohol. They are 4 times more likely to also abuse alcohol when they grow up. Alcohol abuse also disrupts routines such as bedtimes and mealtimes, which are necessary for a child's healthy development. Drinking can increase the likelihood of getting into fights, displaying disorderly conduct in public, driving under the influence, and becoming involved in domestic abuse and violence. These behaviors affect the entire community and often put innocent people in harm's way. There are many drug and alcohol treatment centers throughout Huntington Station. The Huntington Drug and Alcohol Counseling Center is a not-for-profit, outpatient substance use disorder treatment and prevention center. Their services are highly individualized and includes evaluation, assessment, and referral, as well as group, individual, and family counseling. They also offer specialty services for adolescents, individuals with gender-related issues, impaired driving offenders, and individuals whose primary language is Spanish. They offer both prevention and treatment presentations and services within the community. Another facility that is easily accessible in Huntington is the Mountainside Treatment Center, which offers outpatient services, recovery coaching, medication-assisted treatment, and specialized adolescent services. Although no one is turned away from seeking treatment at the Huntington Drug and Alcohol Counseling Center, there is an initial assessment fee of $50, which may be off-putting for individuals who cannot afford any extra expenses. Also, despite the abundance of programs and services for adolescents, there seems to be a lack of support for young children affected by relatives who are struggling with alcohol abuse. Lack of support for this population could lead to detrimental effects as they age.
Research has demonstrated that policies and environmental strategies are highly effective in reducing alcohol-related problems by focusing on political, social, and economic contexts in which these problems occur. The Communities Mobilizing for Change on Alcohol project included 15 communities in Minnesota and western Wisconsin aimed to reduce access to alcohol among underage youth. The randomized trial was conducted in 7 intervention communities, with 8 communities serving as controls. The project addressed the following issues: community policies, community practices, youth alcohol access, youth alcohol consumption, and youth alcohol problems. The study could be utilized in the community by training organizers about evidence-based environmental alcohol prevention strategies and the methods and techniques of community organizing. Information should be given summarizing environmental strategies, organizing methods, and relevant alcohol laws, as well as text on community organizing for health.
It is important to follow certain interventions in order to get the appropriate outcome. With following the SMART learning objective approach, we will be able to help youths that have alcoholic parents with interventions that needed, such as education via a 60-minute presentation on metabolism of alcohol and drugs in the body in order to dissuade youth from following their parents' path of alcoholism. This presentation will be shown to alcoholics that are adults in order to better educate them on the effects of alcohol. It is important to address knowledge deficits in the community in order to educate them appropriately. In order for an intervention to be successful, it is important to follow a clear learning path with clear objectives to follow. Using the SMART learning objective approach, we can achieve this outcome, which serves 3 main purposes. We must give the learner a clear idea, the ability to present a clear goal, and the basis to evaluate the client. SMART is specific. Say what the learner will do, and have it be measurable by the end of the training session.
By researching our chosen community, we were able to see that most of the population was composed of whites, Hispanics, and Latinos. According to statistics, the population size of the suburb of Huntington Station is roughly 33,000, with the racial profile comprising 47.2% white, non-Hispanic, 8.23% African American, 20.5% Hispanic, and 16.9% white Hispanic. We have also identified the problem, such as members partaking in unhealthy behaviors. This includes consuming alcohol and taking illicit drugs. If you would now direct your attention to the PowerPoint screen, you will be able to see the statistics of drug and alcohol use in the community of Huntington Station. So, understanding the problem in the community, it is very essential that teachers and other staff are trained in detecting alcohol abuse. Teaching should also be done at an early age, since as evidence indicated, there is a strong connection between advertisements and the likelihood of consuming alcohol. It is shown that children that see these advertisements believe alcohol will make them popular, and they will tend to grow up to be alcoholics. Now, if you take a look at the PowerPoint, you will be able to see some very concerning statistics involving alcohol and drug abuse. There are some programs in place, however, such as Too Good for Drugs, Teen Intervene, and Drug Addict Education. It is also very beneficial to children that these programs are in place. Additional teaching that the other students and I would provide is also an excellent bonus and reinforcement to the children and adults of Huntington Station. This intervention we will do will be a 60-minute presentation on the metabolism of alcohol and drugs in the body in order to dissuade youth from following in the parents' path of alcoholism. The presentation will also be shown to alcoholics that are adults in order to better educate them on the effects of alcohol. It is important to address knowledge deficits in the community in order to address the problem and to ultimately keep the problem from escalating on a bigger, more detrimental level.
This is our poster presentation. In order to better see it, there's a link for the PDF inside the email.